Continue talking about this bill, because we've seen other countries like Uganda have reported cases, and they even express some level of confidence in the systems and how to handle this. Uganda is very confident they can be able to contain it, yet they share a border with DRC. How come we are not as confident, and yet we are not nowhere that close to DRC?
I think the fact that this disease usually has come around that part of Africa especially, there's a lot of experience, a lot of institutional knowledge, a lot of institutional built-up capacity that has set up the healthcare system to really deal with diseases such as Ebola. For Kenya, we've never recorded such a case. In fact, the truth of the matter is this is not a problem we've dealt with as a country. Therefore, not only are we unprepared, we just have never been tested. The other day I saw a senior government official in the Ministry of Health saying this is our time to show the world our expertise. And I was even wondering...
What expertise?
What expertise? The only expertise I can think of as a country we have to show the world is maybe running. But saying we can handle Ebola and it's our time to showcase that expertise. We have no even case. It's like you, Fred, now if you've never acted in a movie, but you're ready to show us how good.
But Doc, what we are made to understand, and coming from a layman's perspective, is that even in cases of preparedness, that's why they offer a vaccine, introducing the same virus so that the body can build immunity against it. Are you therefore saying that probably if we report or handle a case of Ebola successfully, then would be better prepared? And shouldn't that be a plan?
You see, unfortunately, when you're talking about vaccine as a way of controlling a pandemic, and you saw that with COVID, that's not a solution that deals with sickness and patients. That's a solution that deals with the rest of the population. Number one, the virus strain we have right now doesn't have a vaccine. Number two, even if it were to have a vaccine miraculously, today it was approved and it has gone through all the process. You still have to acquire the vaccine as a country. You need a very comprehensive rollout plan to make sure your citizens are vaccinated. Such things do not even exist as we speak. So even the issue of talking about a vaccine as if it's something you inject to the patient and happens in a hospital, a vaccine is about a massive rollout campaign. And if you remember with COVID, it became an issue where you could not fly without the vaccine. You could not even at one point get government services without it. To acquire such a high rate of immunization within the population that the disease burden comes down.
But I meant that probably, are there any benefits of introducing a virus strain to a country for the health system to be able to contain it in future?
I think even if you are to take that line of reasoning, you don't need to bring the patient to Kenya. Whatever is happening in DRC, let it happen there. In fact, we as Kenyans, we should be focused on treating people before they get to Kenya. And whatever benefits that the new viral strain comes with, and you can develop a vaccine, you can get the vaccine here. So, for example, a lot of us are vaccinated against diseases we've never experienced. So it doesn't require us to bring a potentially sick person to Kenya for us to get sick, to develop a vaccine. All these things are things we are really joking around with, something that can really mess with our population extremely.
Right. And when this news came out, of course, from American media, that this deal, there was a deal between the American government and the Kenyan government to set up this quarantine facility, there's a lot of confusion. And many people, including politicians in our parliament, came out and accused retired President Uhuru Kenyatta of having signed this deal. But only yesterday, President William Ruto came out and said that he is the one who okayed this deal. This is what he had to say.